show us how to do it from the sitting position too? Because I
Sure,
thought that was really
sure.
helpful.
I thought that was helpful too. It's hard now, sometimes, especially when they're in the hospital, the doctor might say, I do not want them to get up. I want you to put it on. I don't want them to get up without their brace on. Well, in that case, you almost have to roll the patient. The way I used to do it is you take the product, you know, like let's say the patient is lying here on this bed. What I would do is get, have the patient heads up here for it. I would take this and I would roll this up like so and place this on the spine. Then I would push down on the mattress and push this under the patient and get it out on the other side. And then of course you've got the rest of it that you put over the spine. And hopefully you've got the proper size the way you can do that. And you want that snug, as I said, and then they can go ahead and get up, and once they get up, then you can tell them to pull the string to the snug. I already showed you how to put it on it when the patient is standing. And here again, if the patient has real serious problems or whatever, then they should be dealing with an orthotist or a caregiver or a nurse or something like that would help them. And a lot of patients have people that come in, caregivers that come in. And that's the kind of person you should be talking to on the phone, not necessarily the patient. So anyway, if they're in a sitting position or if they're sitting or want to put it on, a little easier way, I think, is to be sure here again that the rounded part is at the top. You know, place it in the chair, like so. Just like you would place that, one of those chairs had one of those
lumbar supports in it.
Lumbar supports in it, same kind of deal. Just make sure that this is out of the way. And then all they do is just sit down. It's already basically aligned. And then it's just a matter of doing just what we did before. And overlapping it so it's not bigger side. And then they can go ahead and stand up rather, and kind of position it. If it feels a little low, you know, they can push it up just a little bit. Make sure it's good and snug, make sure that panel is in the center of the body. Then go ahead and undo these. What feels so good when you do that? That compression just holds everything, aligns everything, supports. That's the important thing about this. That's why they're so popular. Now that you've got that on, they go about their business or whatever. They say, okay, I think I'm going to sit down and watch TV a little bit. Feels right, you know. So they sit down with it on, and they say, oh my God, I can't breathe. Then all they do is just take these, just let off a little bit and take a deep breath. After sitting, yeah. Let it off a little bit. Comfortable. It's still supporting the spine. Still has some compression, just not as much. So they're sitting there now, you know, they're comfortable, whatever. They go to stand up, go back and get a Coke or something. Now, I'm great.